Today, the state health officer said Oregonians are letting their guard down with COVID-19 and that small indoor gatherings are driving the spread.
Fox 12's Audrey Wheel is taking a look at the disconnect between what many of us know we should be doing or maybe even think we're doing versus what we're actually doing. She's live in Northwest Portland. Audrey?
Yeah, well, Nora, it is an interesting gap, and we know it poses a challenge for health officials, especially 8 months into this pandemic. So tonight, for some insight, I spoke to the Dean of Psychological Sciences at University of Portland and some folks just out and about.
We haven't seen our family in like a year.
It's been a long go already, and with COVID-19 cases now rising in Oregon, the Oregon Health Authority says following their guidelines is as important as ever.
We could probably do a little bit more by not going out at all, but that's a little bit hard.
The governor and OHA saying you're most likely to get COVID-19 from family and friends. That small indoor informal gatherings are driving the spread. And Oregonians are letting their guard down and need to be more strict with themselves. I asked Dr. Dina Jolka, the chair of Psychological Sciences at University of Portland, if we know to follow the guidelines, or maybe even think we're doing our best, why is it that we're apparently not doing well enough?
I think people, they're getting a little tired of the changes and feeling like there's no end in sight. So willing to make concessions that, well, maybe if I just have this number of people but there's definitely a loosening in terms of behaviors.
And Dr. Jolka says it's not human nature to stay separated and avoid physical touch. Plus, people may have been in the mindset of having to make these sacrifices for 2 or 3 months, not 8 months with no end in sight. And yes, COVID fatigue is a real thing.
With anything that breeds uncertainty and fear, we do get tired of. We can't maintain that level for all time. It's too wearing on the body in a mental, emotional, as well as physical sense.
But health officials say we have to stay vigilant to save lives, not go to any parties, wear face coverings outside the house, and keep distance. I asked Dr. Jolka if there's any way that we can all stay sane and keep following these public health guidelines. And she did have a few tips. She says that physical activity helps a lot. She recommended yoga and meditation. And she says even reach out to people. Talking about anxiety, uncertainty, loneliness can all help. And she says while we're not seeing as many people as we maybe normally would, maybe focus on deepening connections with the people you do see. Reporting live in Northwest Portland, Audrey Wheel, Fox 12 Oregon.